discussion, so we want to take advantage of every minute we have with you today. Thank you, everyone who's come to our FUSE 20th anniversary symposium. We are so excited to be celebrating this milestone at CSH. My name is Kim Keaton. I am CSH's Director of Data and Analytics. And I am going to go ahead and go over how things are going to go today, as well as our panel. And we'll get started and jump in. So we're excited to welcome this panel of folks from all over the country to help lead us through their experience with FUSE. We have Jason Feldhaus. Starting out, we have Jason Feldhaus, CEO of Threshold COC, which is over Omaha, Nebraska, and Council Bluffs, Iowa, starting a new FUSE initiative in that region. We also have Sarah Gillespie, who's the Associate Vice President in the Housing and Communities Division at the Urban Institute, who's been involved in some very rigorous research on scaled up FUSE initiatives. We have Stacy Lowry, who's Director of Community Support Services for Mecklenburg County Government. Mecklenburg County and that's in North Carolina. Mecklenburg County started a program called MECFUSE in 2013. And so she will talk about that. We also have two folks from Bozeman, Montana. We have Greg Overman, who's the supportive housing manager at Housing First Village in Bozeman, Montana, which is a FUSE initiative. And then we're thrilled to welcome Corey Wilson, who's a resident at Housing First Village in Bozeman. My colleague Ryan Moser, who's CSH's Vice President of Strategy and External Affairs, who will offer some opening remarks along with me. And then the panel will be facilitated by CSH's President and CEO, Deb DeSantis. Before we get started on opening remarks, note that due to the size and length of this event, we've disabled the chat function. You can submit questions to the hosts and panelists using the Q&A function, which you probably would need to go to the bottom of your screen and click on those three dots to use. We will do our best to answer them during the session. Also, just note that we have put together a FUSE brief that highlights these communities in addition to others, with some beautiful quotes and other things that has been released today. And we will distribute that in the post event email after this event so everyone can read that. All right, Ryan, do you want to go ahead and get us started?
Yeah, sure. Hi, everybody. It's nice to meet you. I'm Ryan Moser. I'm the Vice President for Strategy and External Affairs at CSH, and I have the good fortune of having been involved in FUSE since the very beginning in New York City. I worked at a reentry services provider in New York City, Women's Prison Association, when we launched the first initiative, and actually had the pleasure of facilitating the very first housing placement under that initiative. And so for me, this has been one of the most exciting things that I've been able to do in my career. This 20th year anniversary is a nice opportunity for me to remember how old I am and how long I've been at this, and to celebrate a little bit with good old friends like Kim, who also worked on that first FUSE initiative, but in a different role at the city at that time. The initiative really started off because there were these two commissioners. One was Martin Horn, who was corrections commissioner in New York City, and one was Linda Gibbs, who was a homeless commissioner in New York City. And they shared an elevator in their office, and they would joke around and point at each other and be like, "Why are you sending me all of your homeless people?" "Well, why do you send me all of your people that have just been released?" And one day in an elevator, one of them said to the other, maybe we should stop pointing fingers at each other and actually try to figure this out. So they launched a discharge planning collaboration that was really a golden moment in how government can work together. And that collaborative spirit kind of created the environment where FUSE came. And that was the time when hotspotters was a new idea. And there was the $1 Million Murray article floating around that looked at somebody who was bouncing around between systems and costing lots of money. And so FUSE kind of fit this space to look at data, to think in a different way about how government can work together, and kind of create a new way of approaching and kind of flip the paradigm, which had always been like, wait, it's almost people's job to figure out how to get into housing, to say, if we turn that upside down and we look at the people that are constantly bouncing back and forth between these different systems, and we say instead, it's our job to figure out how to get the housing to you, can that be effective? you know. And really, I was a part of the group running around when I first started CSH, and even before, trying to get people engaged in the program, going around to old friends in the city of New York and saying, "Would you consider working on this?" And we got a lot of closed doors. You know, a lot of people were like, "This is not the people who housing can work for. This is not going to be functional." But some people got it, and they really embraced the notion that, in fact, housing can work for a lot of different people that might not be getting the opportunity now. And if we pair it with the right services, this could work. So CSH was able to find funding with help from Robert Wood Johnson and some other foundations that don't exist now to be able to launch the first FUSE initiative in New York. And it came with an evaluation. And about 2 years later, we were able to leverage an agreement from the City Office of Budgets that agreed to look at that data and if the program was successful to invest in further stuff. And so that became the basis for how FUSE started in New York. And it kind of spurred interest because we got our first data on how this could work. And I think, Kim, that's where you came in the picture, really, as you were coming to CSH at that point, as we kind of launched in what does it look like to expand this in different places.
Yeah, I think paired with the sort of outcomes in hand and some of that funding, we had learned enough by about 2012 to come up with what we called a blueprint at the time, which was really sort of a playbook for planning and implementing FUSE. We started working. This map, by the way, is on our website and it's interactive. If you want to go to csh.org/FUSE, you can visit it. We've had the opportunity to work with cities, counties, and with states looking to replicate FUSE locally. After just reflecting on 20 years of this work, every community is truly unique. But what they all have in common is it's this particular core group of folks that are cycling between jail, homelessness, and crisis healthcare, often with significant behavioral health challenges that have really poor outcomes for the individuals and for the systems as well. Um, Over the years, we feel like we've proven that convening cross-system collaborators, I mean, these are shared patients, shared clients, shared inmates, to share data and then pairing that with the intervention of housing services that Fusion really stop that cycle for participants and improve lives. And one of the cool parts for me is that in the process, what you observe, or what we have observed, is that systems come up with a new way of talking to each other and working together. You know, honestly, I've seen it over and over again, and it never gets old for me. So just to go through some outcomes, we will hear about some specific community outcomes in the panel portion, and as I shared, there's some in the new brief that we've put out. But just some at the high level, over the last 20 years, we've worked with 50 plus communities to implement more, to implement enough housing to stably house approximately 3,000 people. Um, Outcomes typically find they differ by community, but they typically find that people stay housed, that they are arrested and booked into jail less often and for less time, and that they reduce dependence on crisis healthcare. And often we see an increase in use of preventative care, such as outpatient treatment. It's really a win for people and for systems.
So, Kim, when we first started this, when you first came to CSH, we had this notion that the only way to do Fuse was like we would send somebody from CSH to work with the community for 2 years, would raise a bunch of money to launch it out. It was very labor intensive and it was really hard to do. And so we struggled a lot. And I think it unlocked a little bit. So, talk to a little bit about how the approach to working with communities has shifted over the time that you've been involved.
Yeah, we have a graphic here. Over time, we've really fine-tuned our technical assistance to fall into these four main buckets. So really starting with discovery, working with communities to look at opportunities and challenges related to cross-system data sharing, finding a local champion and the right partners. Um, and then we move into planning, which is really looking at the data in depth, breaking out into work groups, looking at resource identification, and followed by implementation. um, in the particularly in the data sharing and the implementation for portions. Each community is really encouraged to own this part. We don't have like a state static eligibility that we recommend for Fuse. We want communities to put their data together and come up with their own definition of eligibility based on what they see locally, and also their own referral pathways, how they're going to outreach and engage folks. And then we don't always, but we can also support communities through implementation and then thinking about evaluation and scale.
So, almost never in my experience have I showed up in a community and wanted to talk about Fuse or people express interest and they're like, oh, great, we have a bunch of housing resources and we happen to have the services money floating around, and it's all ready to go. So how do people go about finding the resources to pay for Fuse? Like how do they set up the programs?
Yeah. So over time, we have essentially learned that permanent supportive housing or supportive housing resources available through the continuum of care, which are, have to be prioritized for people who are chronically homeless, are not really a match for folks that are cycling between systems. They have too many breaks in their sort of journeys, I guess, to be considered as chronically homeless. And so, one of the best practice that we encourage communities to follow is to seek out funding that is outside of that federal continuum of care. Um, we have found that the traditional approaches just don't serve them. So many communities have addressed this by finding local sources and leveraging other non-homeless system dollars, such as Medicaid for services or other sources for rental and operating funding. And that could be
So,
local funding, that could be other stuff. One useful outcome of putting cross systems data together is it helps really make the case for these resources. Policymakers and decision makers from different systems can really see how these patterns of system use are interconnected and how they have poor outcomes, and they become interested in solutions like supportive housings. We've seen cities and counties make general fund investments in Fuse, for example, which keeps them sustainable over time.
great, Kim. So that part of the working outside of the COC and thinking past some of the federal resources seems particularly relevant now. It's a weird time for supportive housing. It's a challenging policy environment, and I think one of the things that I appreciate about Fuse is that it's a good reminder that supportive housing is actually a lot bigger than the COC, and the idea of pairing housing and services for people that are stuck in crisis and institutional systems is always a good idea, and it's always something that needs investment and care and a way to focus on. It's an opportunity to engage states, it's an opportunity to engage local partners in a different type of a planning exercise. I think for me, I'm excited to hear more about how that ties in with our panel.
And I think I agree. And I think people have heard enough from us. And I'm going to stop sharing my slides and we'll turn over to the panel portion of this event.
All right, and you and I are going to be manning the questions, right? We're gonna work that
Yes.
stuff too. So keep them coming in, folks, and we'll try to get your responses.
All right. Well, thank you, Kim and Ryan. Hello, everyone. Good afternoon. I'm Deb DeSantis with CSH, and it is my pleasure to be here this afternoon with a group of thoughtful individuals who have graciously and generously agreed to share their Fuse experience and knowledge with us as we celebrate 20 years of communities working differently. So we have a lot of ground to cover in a little time, so let's just jump right in. I want to start out by asking Stacy, Jason, and Greg, if you wouldn't mind, could you talk a little bit about your Fuse initiative and why Fuse is still relevant in your communities? And maybe Stacy, you can get us started.
Yes, well, thank you so much, Deb. As far as Fuse, I think Kim and Ryan shared a little bit. We know that in many communities, people with complex unmet needs, histories of long-term homelessness, frequent incarcerations, untreated mental illness, and addictions play a significant role in escalating cost. And most of this cost is avoidable through appropriate models of care that result in better individual and systemic outcomes. And the Fuse model successfully serves the most vulnerable residents who cycle in and out of our public crisis systems and homelessness. And we were seeing that we had many individuals stuck in our jails that had quality of life crimes that didn't need to be there, and we needed a new way to work with them. We knew as a community we wanted a program that prioritized permanent housing. We wanted to be data driven in our decision making, and we wanted it to be flexible and client driven. From that, we specifically created a program that provides affordable, supportive housing for 45 individuals who are frequent users of our criminal justice and homeless shelter systems and have behavioral health needs. That was our priority population. Now, I know you've asked, is FUSE still relevant? We did start our program back in FY13, so several years ago. Is it relevant yet still? Yes, it definitely is relevant. It's relevant because it's built on the idea of making data-informed decisions and utilizing productive community relationships. Using the data and working with trusting providers, mission-minded relationships across our systems is still successful. It's still working. More so, using housing as a platform for stability and not as a reward for good behavior works. FUSE allows us to meet people where they are and break the institutional circuit between jail, between our emergency health systems and our shelter systems. By offering the wraparound supports and more accessible services, we can offer a more appropriate and effective model of care that results in better individual and systemic outcomes. And I'm happy to say that here in Mecklenburg County, we've been able to achieve that by using the FUSE model.
Stacey, can I ask you one quick follow-up question? So how did your community decide to make permanent housing core to your initiative?
We decided that because we had a jail diversion program prior to that was not, it used housing as a reward for good behavior. And what we found in the 3 years that it operated, it was never full. People chose to go to jail because it was easier than to go into the program that had lots of rules and guidelines. We knew that if you had supportive services and place people in housing permanently, that we could have a better outcome. And specifically permanent housing, because if you put people in their treatment and they have no place to go afterwards, we're still going to see this cycling. So we learned through the failure of our other program that we needed to do something differently.
Okay, thank you. Thank you for sharing that. Jason, tell us about your initiative.
Sure. Good morning or good afternoon, wherever you are. I think in the United States or around the world, I guess. But
Mhm.
um, my name's Jason Veldhouse. I'm the executive director of Threshold COC, and we cover both part of Nebraska and Iowa. So we're Douglas, Sarpy, and Pottawatomie County, so the whole metro area. And Fuse really came to us from a strategy from our providers to begin with. And I can't duplicate what Stacey RA talked about. I mean, she's right on all points there. So I think one thing I'd like to really look at and what we're seeing from Fuse is that we're right now just currently in the wrapping up the initial phases, and we're going to go into implementation. But what I always think is that good strategy outlasts environmental chaos. And right now, currently, there's so much change going on at all levels, whether that's at our state legislature or our local politics or even the national and what's going on with HUD. And what I've found is that Fuse continues to be that strategy or that intervention that we can do as a community that allows some stability around what best practices can be involved in, still how we address our most vulnerable and needed populations, and build on what we need most of all, and that's good, solid housing with attachment to good quality services. I think we do a lot of good things in this community. We have great service providers. We have an amazing philanthropic community that supports those service providers, and we provide a lot of great services. We lack affordable housing just like everybody else. But at that intersection, I think is the magic piece, right? Making sure people have the housing and then wrap around those services with it. And this Fuse model really allows us to have that greater conversation, followed by exactly what Stacey kind of highlighted is that data driven, really identifying the most vulnerable in our community and putting those resources where they need to be. Our work right now is stabilizing our ability to find local investment from both our county and our local city governments with the change at the federal level. We're going to see drastic changes at a federal level in funding, and that's to be considered and understood. But what we still need is some type of sustainable funding and available investment. And we do believe at the local level, this makes a lot of sense. The data proves that it's just an offset of investment. Our local governments are already committing to these individuals in other ways through other system investment. We feel that we can pull that out, do it in a trauma-informed, human-centered way, using FUSE as that model, get people housed, still pay for the services that we're paying for, whether it's going into corrections or our hospital systems or into our homeless system, but put it in a place of permanency where they can grow, recover, and move forward. So we really see FUSE as really targeting both our ability to adapt our way of doing work for sustainability from an investment side, but also deliver best quality services in a place that's in an opportunistic or a place of opportunity for our individuals that need it most. So FUSE has come to us at the right time. We are seeing fastest numbers with fixed income and senior populations. We're seeing our chronic population increasing year in, year out. And so this really targets those most needed individuals in a way that will make sense in the future with a strategy that's long-term and proven. And we think all three of those things really make it a strong improvement to our system.
Great. Jason, we're going to come back to talking more about the data, and when we do, I think I'm going to want to ask you, how do you get folks in Nebraska to listen to the data, to learn from the data, and to make data-informed decisions? So start thinking about that. So Greg, tell us about your initiative.
And so in Bozeman, Montana, we have Housing First Village, which is a collection of 19 tiny homes, as Corey will speak to. Over 70% of our selections for Housing First Village have come from our countywide FUSE initiative. Yeah, and I think the core for me of the question is why FUSE still matters. It's it's a question that, like, I just look around this place where we're at right now, and continuing to serve the people that were selected 4 years ago. There's a resident who lives here. She's from the FUSE list, and she lives in Unit F, and she likes to say that F means for forever, because when she thinks of permanent housing, she views it as permanent. Her barriers that came from being on the FUSE list aren't magically going away. We're continuing to serve her, and she celebrated 3 weeks ago 4 years in housing after experiencing homelessness for over 30 years. So the FUSE list matters because we're continuing to serve those individuals, and overutilization of services isn't going away. We're still identifying those individuals, still moving them in. So that problem hasn't changed. We're still addressing it through programs like Housing First Village, which just really matters. I think in Bozeman, like, it's a rural community. So I think the power of a place like this shows that, like, when the FUSE list in a rural community like Bozeman is 19, 20, 21 people, you have 19 units, you can put a really large dent in that. And when you're putting that dent in and you're continuing to use that list year after year, you see, individuals that they're not 30 years of chronic homelessness, they're like 20 and then 15. You're addressing the highest needs and then moving further. So also just the FUSE list and utilizing it and utilizing that knowledge has increased in our community, just cross communication across services. Like, when we're moving individuals in here, we're collaborating with, the emergency department. We're collaborating with the detention center. We're collaborating with the state hospital. Like, when we're moving somebody in, people know, and they're calling me and they're talking about how can we help, that type of collaboration for those individuals with high needs. Like, this shows that people care, and ultimately too, I mean, why the FUSE list matters. I'm just really honored and privileged to be sitting next to Corey Wilson right now, who lives here, who is a resident, and I think as of 9 days ago, uh, 2 years. And just to see her, thrive and what she's accomplished, like, to think about why the FUSE list still matters. I mean, it's 2 feet away from me, right? That's why
Yeah.
it matters. And
Yeah.
Corey Wilson's daughter is in her house right now, and that matters, So yeah.
Yeah. Thank you for that, Greg. Corey, what do you want to tell us about the being a Fuse resident?
Well, it's a lot easier than being on the streets. I'm able to get all the medical needs I like. Uh, they help me with substance treatment. I see a counselor for that every week. I'm actually still dealing with CPS right now, and that now that I have like a stable environment for my daughter, they're more up to let me have her back. So yeah, they've also helped me with like therapy, and they help me get to like grocery shopping, uh, toilet paper if I accidentally run out. Yeah, I mean
Mhm.
like
As we all do.
yeah, like small
Mhm.
things that like you wouldn't take for granted. Like
Yeah.
they help me get to the food bank. Like they support me in having my child at my house. That's a big thing. I mean, I was homeless pregnant, and if I didn't have a house or anything like that, my baby would probably went into foster care. Like,
Mm,
yeah. So,
great. Well, thank you. Appreciate you sharing that for us. So thank you, Corey. Um, so Sarah, let's talk a little more about Fuse on a larger scale, right? So Urban led the study of the Denver Social Impact Bond Initiative, which was an attempt to bring Fuse to scale in Denver. What lessons learned for communities or states that are contemplating Fuse at a larger scale can you share with our audience?
Yeah, absolutely. And I think, well, first of all, I'm honored to talk about the Denver SIB. There are so many amazing partners that brought this project to life. One of the benefits is that we are now looking back almost 10 years to the start of the Denver SIB. And so these lessons learned, we have the benefit of hindsight and all of this time to kind of understand what really worked and what led to so
Sure.
much of the impact that that project has had. And one thing which I think you've heard echoed from all of the panelists so far is really just starting with a data-driven understanding of the population and the people that your program is intended to serve. And thinking about how it worked in Denver, it was a data match between the police data and HMIS. And basically, that helped the community understand there was this population of people experiencing frequent arrests and experiencing homelessness that weren't known to the HMIS system. And even though the providers, they're the first to say it today, they thought they knew then everyone who needed supportive housing in the community. But once this list came to life based on data, they saw that there was a much larger population that needed this supportive housing program. And so first of all, it's kind of using that data to understand the true size of the population. And then there's a bunch of lessons around then what does it take to actually successfully outreach and engage the folks that the program wanted to serve. So I think there are a lot of lessons around bringing new partners to the table, which I think one of the big takeaways in Denver is that supportive housing came to be seen not just as a housing solution, but it became to be one of the city's criminal justice solutions, one of the city's healthcare solutions. And then over time, you saw all of those partners coming to the table and seeing those outcomes as part of what they needed to improve outcomes in their own system. So that brought resources, it brought expertise that really just helped that program grow. And then I think the other thing I wanted to say is just so many lessons learned about using data for continuous improvement as the program went over 5+ years. The Denver program kept a very detailed dashboard that helped providers see how many people were entering housing, how many people were leaving, why were they leaving, where were they going, and that process never stopped over the many years of the program. They were constantly using data to understand how to improve the program, and the program really morphed over time. It didn't necessarily stay the same. Strategies changed, services changed, and the way that they continued to have good outcomes and impact was by using that continuous improvement process with the data that it was really all of the focus on the data.
Yeah, I'm really struck by how you just talked about, Sarah, and how each of you have talked about the importance of building these different relationships, like across sectors, new partners. So I'm curious to hear from all of you on how does Fuse help you to think in a different way, help a community think in a different way and a long term, and does bringing the systems together actually build a different muscle that then allows a community to look at other issues, solve other problems in the community? Jason, do you wanna start us off?
Yeah, I think the power of people gets unlocked in partnership, right? I think that combined effort and utilization and maximizing those resources and expertise allows us to challenge status quo, ask new questions, look for new answers and innovation and create new innovation. And I think that's what Fuse really brought to our community. We have powerful data systems, CHI. So the big partners that we have at the table to begin with was CHI Medical System, the HMIS system of our homeless Douglas County Corrections, and then our region mental health provider, Region 6. All of us are collecting enormous amount of data. All of us are trying to synthesize that data and look at strategies that create better outcomes for our community. But now putting those four data systems together and then looking at it together to create that innovative way of identifying solutions, that's the new muscle. And not only is that new muscle stronger, but it's more comprehensive, because some of the questions that we had in the HMIS system, like, well, what truly is our mental health status in this community? How do we efficiently affect that? As people come out of our correction system, they're identified as being homeless, but what does that mean in light of their timeline and time in the community? Are they in shelters? Are they in housing? Where are they as a risk of homelessness? Now we can answer those questions together. So I truly think the power of unleashing the power of people is in that partnership, being able to collaborate across that and make innovative decisions that lift us all up at a better income or outcome across our community.
Jason, what can communities that are at the beginning of their Fuse journey uh, learn from you in regard to data sharing? And what are some of those challenges up front to getting the different parties to
Yeah.
coalesce around the need to share data?
I've always said collective impact and collaboration is an exercise in patience, right? Don't jump to conclusions. Don't get out in front of it. Um, um, be intentional about the relationship building as well. I think there's nothing more valuable in our community than strong relationships, and that will lead to trust, which then will lead to unlocking the data. It's a process. It takes a while. You just be patient. Don't jump out in front of it. Allow the relationships at the table to be developed, grow, build that trust. And then the last thing, too, kind of off the top of my head, is transparency. Having open and honest conversations and understanding that the flaws aren't owned by the individuals at the table, but are systematic. And we have to understand that it's nobody's intention to have the challenges we're facing in our community, but it is our duty to address them. And those are two separate things. It is nobody's fault, but it is somebody's problem. And we have to just work across that as a collaboration.
Thank you. Stacy.
It's kind of similar to Jason. Our community Fuse really allowed us to broadly look at our community and use data to identify and solve critical issues, right? Like I stated earlier, we started by trying to solve the issue of jail capacity and overcrowding. And doing the same old methods of building new jails wasn't going to solve the core issue, which was that we had unmet needs in our criminal justice, mental health, and our homeless services systems. Turning to data and really digging in gave us the freedom to make better decisions. Additionally, FUSE allowed us better ownership of our own community. Instead of placing the burden of responsibility on one system or organization, kind of similar to what Ryan shared with the two commissioners, it allowed us to join together, specifically our perspectives within our criminal justice system, our mental health, and our homeless provider system. And we developed a joint understanding of how we can work together for a better outcome, specifically for our community's needs. Building this process allowed us to be better neighbors and really stronger allies. Listening to the other systems and their needs and learning from each other directly allowed us the buy-ins that we needed to move forward. It also highlighted our shared interests. And FUSE and CSH helped us identify and engage with all those partners that we needed to support the implementation by sharing past experiences with other communities, sharing relevant data that resonated with our partners, and they facilitated structured and productive meetings, that transparency, and coordinating site visits to learn from other colleagues in states and communities. That was key for our different systems to see how it impacted them.
Great. Thank you. Greg.
Yeah, thinking about how FUSE has caused our community or our organization to think differently. I think in looking at what was working and then also what wasn't working, and then pairing that with the data. When we looked at our outcomes over the first 2 years, we saw an 80% increase for all our residents in preventative healthcare, and then specifically a 54% increase in behavior healthcare. And for me, that really struck me. The increase in individuals, as Corey mentioned so well, like having access to therapy for individuals that are in those systems and get going into housing, what it means, to be accessing therapy for the first time in your life. And now we looked at that after 2 years, and we're in a rural community. Access to like Medicaid billable behavioral healthcare is pretty limited. It's hard. Treatment facilities, inpatient, it's limited here. But leaning on our partners, working with a PAC team that we now have on site, over 80% of our residents here now access therapy on site every day. So building that and building it and building it and making it more, and using our partners to do that. And then also, thinking differently about what wasn't working, that when we did our first selection of FUSE, as a result, we had very limited representation in this place of individuals from the LGBTQ plus community, individuals of color, veterans. It was like an 80-20% split, male to female. And we looked at that, and I could talk a lot about it, but we altered the way we look at our FUSE data. And now as a result, we have 50% men and women. As a result, now we're over 30% individuals of color. We have representation, and so on and so forth. That like we looked at our data differently because it wasn't working. And then also too, I think again, the cross systems, we recognize as a community that individuals being discharged from the state hospital over and over and over again, like our struggles with meeting the needs of those individuals. And now we have a county program that helps bring those individuals back. And when people live here at Housing First Village and they're coming back from the state hospital, they have additional resources. The state hospital calls me frequently about individuals that they view as frequent users. And that's just has helped a lot. So.
Greg, what kind of processes have you put in place to ensure that the different partners are coming together in some regular and meaningful way?
Yeah, I think just establishing really regular communication. Obviously, coordinated entry systems is huge for us. And then also, collaborating with our local health partners who work on site. We have CHP, which is a FUHC that is in our county. We have weekly meetings with them about providing care. Our PAC team is through the SPRE, which is the mental health partners, that's on site. I think just building and building and building that communication, and then word spreads, and it's just more. I think when we started, like, I felt like it was just a few HODC employees that were here, and now, like, Corey was laughing when we were setting this up because we're in an office here, and the door's just knocking. Like, it's just like we can't even. It's like somebody's at the dang door all the time. And I turn around and, I mean, there's medical practitioners that are knocking on the doors, and it's not just,
and they go to each individual house and they give individual set things to their needs, which is very nice. Like, I wouldn't even know where to begin if it wasn't for this program. Like the therapy, the medications, they actually drop off the medications if you're not able to find a way of getting to the store to pick them up. Like on-site therapy, like it's amazing. And the people that live here, we are a community because usually we throw food get together so we all can like have a communication and just like be social, like feel like a normal person.
Yeah, that's awesome.
Yeah,
And
I think
yeah.
buy-in Corey's bringing up, that the people, the partners that are here because of what Corey's saying, they have residents that want it, and like Corey's is a great example. Like, you hear her tone of voice, like she's excited to have behavioral health in her house, right? Like, so the partners want to be here because the residents want it, and then the community thing, it just feeds off of it. Like, Corey's working, can I work with them too? It's just super positive and healthy.
Right. What I'm hearing you say, I think, is that by having the different partners involved and the partners sharing information that's very resident centered, that Corey then gets the support Corey needs that's tailored to Corey. Corey's not just treated like, a faceless human being, but there's greater understanding of what Corey's needs are and how to support Corey and her. Yeah, that's wonderful. So let's talk a little more about the data then, and the evidence. So we have celebrated the outcomes that each of the communities have experienced through the FUSE initiatives. We talk a lot about housing stability and reductions in systems use. But share with us some of the specific outcomes in your community that have been really meaningful. And before I hear from Jason and Stacy and Greg, I would love you, Sarah, to describe at a kind of higher level the outcomes from the Denver program that, in this case, had the rigorous randomized control trial design.
Yeah, sure. So yes, it was a randomized control trial, which means we were comparing outcomes for people who were referred to supportive housing, and we compared those to people who didn't have access to supportive housing. It's a scarce resource. There's not enough for everyone who needs it. So we could follow outcomes for those folks who were just accessing whatever other services were available in the community. Usually that looked like emergency shelter. And so what we found is that among the people in supportive housing, 86% of participants remained in stable housing after 1 year, 81% remained in stable housing after 2 years, and 77% remained in stable housing after 3 years. We think that's really compelling housing stability results. First few studies track it for 3 years. And so we now know that most folks are staying in stable housing even after 3 years. And then second, we know that this was among people with the highest unmet needs in the community. They weren't knocking on service providers' doors. They weren't even known to HMIS in most cases. And still, 3 years later, most were successfully still stable in permanent housing. So that's the housing stability outcomes, but we also found some really significant outcomes across criminal justice system and the healthcare system. On the criminal justice side, we found a 34% reduction in police contacts, a 40% reduction in arrests, a 30% reduction in jail stays. This starts to sound like a lot of numbers, but you can hear it's just meaningfully breaking that homelessness jail cycle. Less interaction with law enforcement, which leads to less housing instability when you're coming out of jail. It just is breaking that cycle. And then along with that, on the healthcare side, it kind of supports the theory of change for supportive housing. We found 40% decrease in ED visits. And then on the flip side, a 155% increase in office-based, community-based visits, healthcare visits, which is what we want to see happen. We want to see people connected to the service, the healthcare services they need, but not avoiding as much as possible the more acute emergency care environment. And then also a 29% increase in prescription medications. So what we also did is look at those outcomes are all associated with real cost to a community. So not only are they much better outcomes for people, they're better outcomes for the community as well. So SIB participants had almost $7,000 less in total annual per person cost, just associated with other public services. And so this is such a narrow view of, you know, the benefits of such a program like this, but these are real dollars that are compelling to city leaders. And so those dollars were avoided in things like the reduced jail stays, the reduced ambulance rides, the reduced ED costs. And so altogether, that meant about half of the total per person cost of the supportive housing program was offset by the reductions in these other outcomes. And, you know, because a lot of those cost reductions were for things that the city and county of Denver paid for, it actually almost fully offset the cost to Denver because they were leveraging state housing vouchers, they were leveraging federal Medicaid, and then they were getting better outcomes on the local side. And so there were some real cost avoidances for Denver. So the last thing I'll say is that these results were really compelling to a lot of people. One of the main questions I get is, why are we still researching supportive housing? We know it works. And all of us here do, we know that. But there are still policymakers, especially those who are not in housing, that need this type of data to make their best decisions. And so, for example, the city council passed a new line item in the Denver budget that every year now funds supportive housing services for people in this program, keeps it going. Colorado Medicaid used this data to take the supportive housing model statewide because they saw the real benefits in healthcare utilization. So altogether, I think it's just been a really compelling model that people want to get on board with. They see the success and they want to be part of it.
Thank you, Sarah. So there was a lot in what you shared that's exciting. Two things popped for me. One was what you said about the data you shared around the increase in the primary healthcare visits, which seemed to align with what Corey shared with us, right? So Corey, you talked about how you're in the tiny home and you have wonderful support staff, and that's helping you to get to doctor's appointments and things like that. So I can imagine that, you know, if you're probably spending less time in the emergency room if that was a place that you had been utilizing before.
Yeah, I actually go to the doctor now. Yeah.
Nice.
Yep.
Nice. And then the other thing I heard you say, Sarah, is exciting is that the data doesn't end with the data, but there are communities that are actually using the data to influence or inform decision makers, right? And so now we see new resources being dedicated toward supportive housing as a result of the data that's generated from the FUSE initiatives. Thank you. Stacy, what do you want us to know
Yeah, well,
about your experience?
For MacFuse, similar to what Sarah said, obviously we saw housing instability increase. We reduced recidivism and broke kind of that cycle of multiple crisis system use. But really for us, MacFuse proved to our community that it works, right? Permanent housing paired with services works. And we can use this approach to expand needed services and allocate funds to additional targeted needs. With MacFuse, this was the first time that Mecklenburg County government funded rental subsidies and supportive services together. Since then, Mecklenburg County has actually prioritized affordable housing, which in our state is not a county focus, it's a city focus. And we fund multiple nonprofit agencies for both rental subsidies and for supportive services. We've also implemented other data-driven housing programs, including Keeping Families Together, which targets the frequent users of child welfare and the homeless service systems. We also have a foster care youth aged out program for foster care youth who are experiencing housing instability. And I really think that the success of MacFuse provided the county with the confidence to further invest in this area of need. So that was kind of the winning thing for us.
Great. Thank you. Jason.
Yeah, we're actually Thursday we have a big community meeting where we're going to provide data, combine data sets and really look at it. So I don't want to get too far out in front of my community, but one thing I definitely think is really interesting is first off, Stacy, I think Sarah laid out kind of Emerald City for us, and that's where we're headed. This data really allows us to look at how to leverage it across multiple strategies to increase the initiative of FUSE as a viable strategy in our community. And one of the data points that we've seen just early on is that people that are in our Douglas County Corrections are spending 9 times more time in jail just because of the risk of homelessness. And so, I mean, just the additional trauma, the separation from society, the reentry efforts and cause, that instability, it's just so drastic to the individual that's being served and as a community as a whole for our ability to help people thrive and move forward. And so that's an interesting data point. Another real data point is that I think someone said it earlier. We're finding that most of our charges and people are going to corrections is because of quality of life charges, not because of what corrections is designed to do and provide to society. So we really think we're right on the verge of some of those details coming out. And like I said, I don't want to get out in front of my leaders in the community that'll have an opportunity to present that to our community. But we really see exactly what Sarah said, and that is that data will allow us to have multiple conversations with individuals in key places to make decisions about how we address homelessness moving forward and how cross system wise we address and help people thrive as a community.
Thank you, Jason. Greg, what do you want to highlight?
Yeah, I think we've seen, as others have shared, we've seen, and I've mentioned earlier, an increase in preventative care. We're super proud of our increase in behavioral health care. We've seen a reduction in services from the beginning of the program, and that continues to increase. We're super proud of our housing retention. I think, we have 18 units, so it's smaller, so like we were able to like identify individuals. But I mean, over 4 years, we've had 0 evictions. And that's something we're super, super proud of. There's 3
That's great.
individuals that were identified here at the beginning that have lived here, all 3 of them for 4 years. If you look at their history with homelessness, those 3 people, it totals between 70 and 80 years of homelessness combined for the 3. And over the past 4 years combined, they've had 12 years of housing. That's pretty wild. Like that, like, is this, I don't know, super important. And that housing retention, you saw Corey's look of pride when she said 2 years, that it gives her time to like create that stability and achieve her goals. So, hey, for us, housing retention is something we really super lean on. And we want people, and Corey's a leader here. She's not going to get time to talk about it. But if I saw her after a week of vacation, I walked in this morning. I was like, "You ready?" And she's like, "When's my neighbor moving?" She gets excited about the new people that are living here because she gets to see that moment. And I don't know, that housing retention allows for that. So.
It's a beautiful
Corey,
thing.
oh, No, go ahead. I'm sorry. I didn't want to interrupt you.
It's a beautiful thing seeing people moving, especially when they're toward the end of their life and they don't have much time left. Just giving them a chance to have a place to live, so they say that they accomplished something before they pass away. It's a good feeling.
Thank you for that. What I was going to ask you is if you were sitting across from a mayor, a senator, a Congress member, what would you want them to know about your experience?
Well, with the experience with tiny houses, I've been able to get off of drugs, live in a house for 2 years, take care of my child. My daughter was in foster care for a little bit due to my addictions, but I was able to fight and get her back with all the support with the people around me, and actually heartfelt support, not just like, oh, you could do it. No, like, you can do it. Like actually get it done. But like without the programs, I don't think it would be very successful. Like, you have to have the programs to help people succeed in life. Like, if they don't have any way of knowing, like, some people are used to eating with their hands, but when you move into a house, you learn how to use silverware.
Mhm.
Like they forget their basic needs, but with these programs, they're able to learn the skills to be able to function in society.
Thank you. That's very powerful. Very powerful. Is there anything about the outcomes surprise anyone? Or asked differently, any outcomes through your initiative that surprised you?
I don't know if it was a complete surprise, but when we did our evaluation, one of the things that we heard over and over again was the connection to community. So being
Mm,
able to foster relationships with parents, adult children was high on everyone's list when they talked about what they were able to accomplish with their first year in housing. And that was not necessarily what we thought would be one of the first things they thought about, but our tenants really said that connection and giving back and fostering those relationships was one of the things they were most proud of.
okay, thanks. Anybody else? Any other surprises? No? Okay, so maybe let me ask the rest of you what I asked Corey. If you were sitting across the table from someone who could devote resources to supportive housing and your FUSE initiatives, what would you want them to know? I need you to
Um,
change
I'll
hearts and minds.
I'll jump in really quick, and the best part is that Fuse has gone through the door with me on all of these conversations lately, and we've had city ordinances about encampment closures. We've had criminalization bills at the legislative level, both Iowa and Nebraska. We've had a lot of conversations with our federal delegation about the future of the COC and NOFA funding and those kind of things. And Fuse for me is a strategy that has been in and on the agenda every time we're having conversations. And what I think people are looking for, at least what I've noticed at all three levels, is people are looking for solutions. I think there's a lot of grace in that. There are people looking for solutions, and it gives a concrete solution that we all can look at from different angles as a solution for both a housing outcome and an ability to help get people the services they need to thrive. And so I've had the privilege to have those conversations lately, and having Fuse with me and the knowledge I've gained from it over this last year has been so valuable, because it is truly something we're pitching to all of those influential individuals as the future, something we can do together, something that offsets costs that are already being expended on some other type of outcome. And it's just better for our community and the people we serve. So
Wonderful. Wonderful. Anybody else?
I was gonna say, I think I find myself always saying there's a cost to everything. There's a cost to doing nothing. There's a real cost to doing something that doesn't work, and there's a cost to doing something that works. But in return for that, we have decades of evidence that show what you get for that cost, the outcomes that people have, and then the outcomes for communities and the better use of taxpayer dollars. So I think we have to choose what we want to spend that money on.
Great. Stacy?
I would just add that, FUSE is a model that works. It's replicable. You can do it in an urban area. You can do it in, a rural area. You can also do it whether it's a red state, blue state, purple state. It works. And it gives us better outcomes for our whole community.
I think I'm getting t-shirts for everyone, Stacy. The Fuse, it works. Greg and Corey, close us out.
I think, not to tell Corey's story for her, but she talked to me before this, and I'm a story person, and I would look at, people with influence and tell her story and tell her that, or tell them that Corey told me a story this morning that last week she went Christmas shopping for her daughter, and she had a car full of presents for her daughter. And when she was going through the parking lot with those presents, she passed law enforcement officers that knew her name, that knew her, that interacted with her when she was a frequent user of services. And she said that the look of pride on those law enforcement officers' face because of what she's done and what she's achieved. That's a system that works, that they see it, and they're proud of her for what she's doing. And this allows for that.
Thank you. Thank you for that. Thank you for sharing. On behalf of Corey, and Corey, thank you for sharing your story with us. I want to thank all of our panelists for spending time with us today and sharing their stories and sharing their experience and really contributing to today's celebration. Without your work, we wouldn't be here talking about the outcomes that you all have achieved and highlighting what other communities can learn from your experience. So thank you for that. And wishing everyone happy holidays and happy new year. Thank you.